Hi everyone, this is Dr. Khan, and today we will be discussing the anatomy of the pericardium and few of the clinical correlations that are related to the pericardium. So today's main topics are the anatomy of the pericardium, acute pericarditis, pericardial effusion, and the cardiac tamponade. So starting with the definition of pericardium, it is a fibrous serous sac that encloses the heart and the roots of the great blood vessels that are entering or exiting from the heart. Okay. Pericardium is a fibrous serous sac that encloses the heart and the root of the blood vessels. Those blood vessels that are either entering the heart, like the pulmonary veins and the superior inferior vena cava, or they are exiting the heart, like the pulmonary trunk and the aorta. It has two parts: the outer part, the tougher part, known as the fibrous pericardium, and the inner part, which is serous part, secretory part, known as the serous pericardium. The serous pericardium again has two layers: an outer layer, the parietal layer, and an inner visceral layer. Okay, so we have got pericardium, which is composed of an outer layer, the tougher one, the fibrous pericardium, and a secretory layer, the serous pericardium. The serous pericardium in turn is composed of parietal pericardium and the visceral pericardium. Fibrous pericardium is a strong fibrous part of the sac. It fills with the outer layers of the blood vessels that are passing through it. That are the aorta and the pulmonary trunk, which are leaving the heart, and pulmonary veins, superior vena cava, and the inferior vena cava, which are entering the heart. Then it has got attachment below with the central tendon of the diaphragm, and it is attached in front to the sternum with a ligament called the sternopericardial ligament. Okay, so the fibrous pericardium, it is the outer layer, it is tougher layer, and it has got attachment in front with the sternum, below with the central tendon of the diaphragm, and with the entering and leaving blood vessels. Here you can see this is the heart, this is the right ventricle, and this is the vessel leaving from the right ventricle, the pulmonary trunk. And this is the magnified view. In magnified view, you can see this is the pulmonary trunk, and attached to it is the to the root of this pulmonary trunk, it is the fibrous pericardium, the outer tougher layer. Then inside to the fibrous pericardium, this is a double layered structure, the serous pericardium. Okay, the serous pericardium, it is composed of two layers: an outer layer, which is then reflected at the root of this blood vessel, and then reflected and then comes back to line the wall of the heart, and this is the visceral layer. Okay, so serous pericardium is the layer of the pericardium which lines the heart. Okay, and it has got two further layers: the outer one, parietal layer, which lines the fibrous pericardium and is reflected around the root of the great blood vessels to become continuous with the visceral pericardium. While the visceral pericardium is a layer that coats the outer surface of the heart and is also known as epicardium. This is the fibrous pericardium, while this is the outer layer of the serous pericardium, the parietal layer of serous pericardium. Okay, the parietal layer of serous pericardium, which when reaches the root of the blood vessel, it reflects back and continues as a visceral layer of serous pericardium. Okay, the parietal layer of serous pericardium, it lines the fibrous pericardium, while the visceral layer of serous pericardium, it lines the wall of the heart. Okay, this is the wall of the heart, and the wall of the heart is composed of three layers: the innermost layer, which is towards the cavity of the heart, towards the cavities of the heart, it is known as the endocardium. Then a muscular thick layer, myocardium, and then the outer layer, the epicardium. Okay, the epicardium, it is another name for the visceral layer of serous pericardium. The visceral layer of serous pericardium and the epicardium, they are one and the same thing. Now, the pericardial cavity, it is a term used for the slit-like space that is present between the visceral and the parietal layers of the pericardium. Okay, pericardial cavity is the cavity, slit-like cavity present between the two layers of the serous pericardium, and it contains a small quantity of fluid, which is approximately 50 ml in quantity, and this is known as the pericardial fluid. So we have got pericardium, pericardial cavity, and within the pericardial cavity there is small quantity of fluid known as the pericardial fluid. And the function of this pericardial fluid is to decrease the friction and facilitate the movements of the heart. As you know, that the heart is beating continuously at the rate of 60 to 100 beats per minute in normal healthy individual. So because of this continuous beating of the heart and this sternus activity of the heart, lots of friction is supposed to be produced, and this friction is reduced because of the presence of these pericardial layers and this pericardial fluid. The undersupply of different layers of the pericardium that is different. The outer two layers, the fibrous layer of pericardium and the parietal layers of serous pericardium. These two layers are supplied by phrenic nerve, which has got a root value of C3, C4, and C5. While the visceral layer of the serous pericardium, which lines the wall of the heart, it is supplied by sympathetic trunk and branches from the vagus nerve. So the first clinical condition relating to the pericardium is the acute pericarditis, and it means the acute inflammation of the pericardium. And its causes can be memorized by the mnemonic midnight, in which the M stands for metabolic causes. And example of the metabolic causes of acute pericarditis is the uremia. If a patient is suffering from chronic renal failure and he has an elevated blood urea, then due to the toxic effects of the urea in the body, the pericardium will be inflamed and the patient will present with signs and symptoms of acute pericarditis. The I stands for idiopathic causes, and by idiopathic we mean the etiology is either unknown, or some of the authors also include the autoimmune inflammatory causes in this category. D stands for the drugs or toxin-induced causes of pericarditis. N stands for neoplasia, either it is primary in origin or secondary, that is metastasized from somewhere else to the pericardium. I stands for the infective causes or inflammatory causes, and a virus, Coxsackie B virus, which is notorious for causing the acute pericarditis. G stands for the genetic and hereditary causes, and T stands for your trauma, which may be either blunt trauma, penetrating, or perforated trauma. Clinically, the patient will typically present with substernal chest pain that aggravates with lying down or with coughing, because with coughing and with lying down, there occurs a stretch on the pericardium, and due to this stretch of the pericardium, the pen fibers are stimulated and causes aggravation of the symptoms of the acute pericarditis, while the symptoms reduce with sitting and with leaning forward. Because with sitting and with leaning forward, the stretch decreases and hence the pain is reduced. Also, beside the typical signs and symptoms of acute pericarditis, the signs and symptoms of the underlying etiology will also be present. Like suppose a patient is having uremia, so the signs and symptoms of uremia will also be present along with the acute pericarditis, like the disorientation due to the uremic encephalopathy and bleeding diathesis and nausea, vomiting, etc. They will also be present. On examination, the pericardial friction rub, they can be auscultated with the diaphragm of the stethoscope. When ECG of a patient with acute pericarditis is performed, it will show us diffuse ST elevation with PR segment depression. Here in V2 and V3 leads, you can see the ST segment, this is elevated, right? The next condition is pericardial effusion, and by this we mean an abnormal accumulation of a fluid in the pericardial cavity. As we know that normally about 50 ml of fluid is pericardial fluid is present within the pericardial cavity, and if excess of fluid accumulation occurs in this cavity, then this condition is called as pericardial effusion. And any of the cause of pericarditis can lead to pericardial effusion, right? As inflammation can lead to the edema formation, or if there is a potential space like pericardial cavity present, then the accumulation of fluid will occur, which will lead to the pericardial effusion. Other causes are heart failure, hypoproteinemia, overhydration, myocardial infarction, myocardial rupture, and bleeding disorder, right? In heart failure and in overhydration, the hydrostatic pressure within the capillaries is increased, which leads to the leaking of the fluid outside of the capillaries. And if there is potential space like pericardial cavity present, then it will collect there, right? And in case of hypoproteinemia, the oncotic pressure within the capillary is decreased, and it will lead to the leaking of the fluid outside of the capillaries. It is diagnosed by performing chest X-ray, echocardiography, and ECG. Chest X-ray will show us the typical water bottle sign. Echo shows the excess fluid collection around the heart, and if in severe cases, if there is massive pericardial effusion, then the swinging of the heart from left to right and right to left, it can also be observed. And ECG shows typical pattern called the electrical alternance. Here you can see the ECG of a patient with massive pericardial effusion, showing electrical alternance. And by electrical alternance, we means that the amplitude of the QRS complex, it is variable, right? It is changing. At start in V3 lead, you can see the amplitude of QRS complex, this is less, and then this is increasing gradually, then again decreasing, and then again increasing, right? Decreasing and increasing amplitude of the QRS complex. Same pattern can be observed throughout the ECG in all the 12 leads. This is a chest X-ray of a patient with massive pericardial effusion, and the heart shadow, it is increased and seems like a bottle which is lying within the chest cavity. This is the echocardiography of a patient with pericardial effusion. This is the base of the heart and this is the apex of the heart. And when I play this for you, you will be able to see the swinging of the heart from left to right and right to left, right? This, you can see, these are these two are the ventricles, these two are the atria of the heart, and you can easily see the swinging of the heart from left to right and from right to left, right? As far as the treatment of pericardial effusion is concerned, if it is a small amount of fluid within the pericardial cavity, no treatment is necessary, it will relieve itself. But if it is large enough, then pericardiocentesis is necessary, which means the procedure of removal of the excess fluid from the pericardial cavity through a syringe, right? And the management of the underlying etiology is also necessary. The condition which is related to the pericardium, it is the cardiac tamponade. It is a life-threatening condition in which the pericardial effusion develops so rapidly or has become so large that it compresses the heart, right? Two different scenarios can lead to cardiac tamponade. Either there is the development of pericardial effusion rapidly, right, in very much less time, then it compresses the heart, or it develops slowly and gradually, but it becomes so large that it compresses the heart, right? And the causes of cardiac tamponade are similar to that of the acute pericarditis and pericardial effusion. And clinically, the patient is present with typical triad called the Beck's triad, in which the distended neck veins, shock or hypotension, and decreased or muffled heart sounds will be present. In cardiac tamponade, as you can see, this diagram shows an animated demonstration of the cardiac tamponade, in which there is excessive fluid collected in the pericardial cavity, so much that it is compressing the heart and is not allowing the heart to perform its normal functions, right? The veins that are pouring the blood into the heart, they are full, right, and they will be appear as distended. because the heart, it cannot relax properly due to the excess fluid, right? So the jugular veins, they will be distended, and if less fluid is poured, if less blood is poured into the heart, then the ejection fraction will also be decreased, and the patient will present with hypotension, and in severe cases with shock. And the third finding is the muffled heart sound, right? Because of the fluid presence and because of the decreased contractility of the heart, the heart sounds will be distant or muffled. The cardiac tamponade is diagnosed clinically with the typical Beck's triad, and if the patient allows some time, then echocardiography and cardiac catheterization can be also performed to diagnose the condition properly. And the treatment is emergency pericardiocentesis and subzephyr surgical drainage, right? This is the end of the slideshow. If there is any query, you can ask me in the comment section below. Thank you very much.